So good morning everybody and welcome to the Greater Manchester Nursing Pathway. We'll take a moment to introduce ourselves.
Hi, I'm Leslie Royal. I'm the Primary and Community Nurse Lead for Greater Manchester.
And good morning, my name's Kerry Porter. I'm one of the Primary Care Workforce Programme Managers.
Good morning everyone, my name's Natasha Rodita. I'm also a Primary Care Workforce Programme Manager.
I'm Moira Rogan-Sark and I'm the lead nurse educator for the Greater Manchester Training Hub.
Good morning, my name's Sam Howard. I'm one of the clinical leads for the Greater Manchester Training Hub.
Good morning all, I'm Dawn O'Brien and I am the HMR Primary Care Academy Manager.
Brilliant, thank you ladies. So this is a collaborative presentation today, working in partnership with GM Workforce Leads and GM Training Hub, as well as the Salford Academy and HMR Academy. So thank you everybody for your contribution.
Thanks, Kerry. This is about the Greater Manchester Nursing Careers Pathway. We're hoping to create a career vision for any person that may be interested in a career in primary care or who may be currently working in a healthcare setting in primary care. The pathway highlights the nursing roles within primary care and the associated development opportunities that exist working in Greater Manchester. Can you have the next slide, please, Kerry? The pathway roles, as you can see here, lead from healthcare assistant all the way through to advanced care practitioner, clinical practitioner, sorry. In developing this pathway alongside our Greater Manchester Training Hub colleagues, we all hope to create a vision that will encourage a career in primary care, encourage nursing as a career, develop internal talent. So just see how people can develop with the support of apprenticeships and the development opportunities available. For example, from admin and reception right the way up to advanced practitioner level, and to develop, support and embed new roles in the primary care system in Greater Manchester. Thanks, Kerry.
Okay, so when we consider what's the entry into primary care, and it's usually via reception staff to give individuals a taste of what primary care has to offer. So we've developed a basic training admin bank. So that's where individuals can register and be upskilled in order to participate and deliver reception skills right across Greater Manchester. We reached into the system as a response to COVID in order to ensure that general practice had the resources available to them. Initially, the reception bank, the training delivered is a number of core competencies. So it's EMIS and vision, document, confidentiality, answering phones, signposting, dealing with difficult patients and safeguarding. The bank actually isn't only just available to admin staff, it's expanded and includes GPs, nurses and healthcare assistants. And if you were interested in some additional clinical roles, then you absolutely could register on the bank directly. So we're going to give you an overview of the Greater Manchester Careers website. It's quite, it's new for GM and it was developed in response to feedback from ST3s in order to access information in one central point. There is a dedicated section to nurses and we'll give you an overview of that now.
Welcome to Greater Manchester Primary Care Careers Platform. On this platform, we'll provide you with information about all the different careers in general practice, from GPs to practice managers, physician associates, to support staff. For this demonstration, we're going to be focusing on the nursing role. On the nursing page, there's a whole host of information to support your career journey, whether you're a newly qualified nurse, an experienced general practice nurse, or a locum. If you're looking for a job in primary care in Greater Manchester, then the job section is for you. We list all the jobs across all of our boroughs on this tab. The health and well-being of all our staff is incredibly important to us. So we've created a health and wellbeing tab. On this page, you'll find information about all the support available to ensure you feel supported and maintain your psychological well-being, especially during this difficult time. There are links to apps that you can use, resilience hubs, and also our NHS staff support line. The events tab has lots of information about everything that's going on across primary care. You can select a particular event by using the calendar function, choosing an event by selecting it, and following the registration details. We're very proud to announce that the CARE programme is one of those support packages recently launched. This package is to increase the resilience of staff and includes a virtual support package that can be adapted and co-designed with local systems to embed new ways of working. You can find out more about the CARE programme on this page, and also by watching the video by Dr. Johnny Marshall, President of the NAPC.
So moving on, going to hand over to Dawn.
Hi, so we have developed a sort of healthcare support worker foundation package, and it's only available to those who are new to the healthcare assistant role. The offer is currently £2 per PCN, and what it is, it's to be able to take your brand new HCAs or those that want to upskill to become a HCA, and then they can carry on with the pathway that we've got on the next few slides. So the first offer is the entry level, and it is a 3-hour webinar, and it comprises of core clinical skills, health screening, urine dipstick analysis. That's to take place. We've got dates in December and January, and then we've got phlebotomy training in December 2020. We've currently got, I think we've got about 42 people who have accessed this, who've expressed an interest. And because of the amount of people involved, we agreed that we would look at supporting them. So we've currently got an advert out for a HCA mentor. That mentor will support that person through that training, but they will also deliver the care certificate and enable them to access the functional skills programme. Sorry, next slide, please.
So in collaboration across GM, the Greater Manchester Training Hub facilitated the resource around the workforce development funding, the WDF funding that practice could access to upskill members of staff. That is just about to finish its delivery, but the strong themes that come from that was that there was a massive need and appetite for phlebotomy again, and spirometry and immunisation training. So in addition to the entry offer, we've got an enhanced offer for existing healthcare support workers within primary care to undertake any additional phlebotomy training, a competency and foundation for spirometry training. So that's the practical element of actually performing safe spirometry, diagnostic spirometry, and the 2-day foundation immunisation training as well. So this will be a modular course that will start a full package delivered by the Training Hub across GM, which will be, we're hoping that will all be free access for all CCGs. We've presently got 15 places per CCG for each course, and you can access either 1, 2 or all 3 of the courses as a full package, which will then we'll carry on to develop and bolster on more training for as a more bigger offer across the patch. Next slide, please, Kerry.
Oh, back to me. Sorry. The next offer we've got on top of that is for those that are already in a HCA role. And what we found is that the majority of staff who are currently in a HCA role don't have the level 3 qualification. We've worked with Berry College and we've sort of tweaked the level 3 qualification to make it more primary care specific. So we have offers available for that. There is currently 3 per CCG. They have to be already in a healthcare assistant role. There is no cost to the practices about this because we're able to fund it via the Levy Matchmaker service. The only commitment from employers is the 20% off the job. But again, we will work together to make sure that we can rotate people 20% off the job and look at working in care homes and in different parts of primary care, so they get to learn the whole sort of remit of what's going on in practices. It's an 18-month course and it's blended learning with online and tutor visits, and there is backfill available for this package and for the initial offer as well. Next slide, please, Kerry.
So before we move on to the next section, has anybody got any questions in terms of the HCA offers? Quite happy for you to save your questions to the end. That's fine. So we'll move on.
That's me. Okay. So the training nurse associate. So this role's been around for this training post has been around for a couple of years now, but quite new to primary care. So this one is a 2-year fully funded level 5 apprenticeship that's running in association through GM with Bolton and Salford University. This sees a number of healthcare support workers from general practices in Greater Manchester undertaking the programme with employer support through the apprenticeship model on a 30-hour contract. They cover the 4 fields of nursing, mental health, learning disability, adults and children's, as all the programmes do. But this programme is unique and it develops the nursing associate, the training nurse associate, to become primary care ready, with a planned final development to be trained to undertake both cervical cytology and immunisations in general practice. A really, really good offer. Next slide, please. So the nursing associate role itself bridges the gap between healthcare support workers and registered nurses and offers an opportunity for many into nursing. Equipped with the knowledge and skills and behaviours that enables them to support the delivery of nursing care under the leadership and direction of a registered nurse. This role is not widely seen in general practice at present. However, this month has seen the inclusion of the trainee nurse associate and the nurse associate roles within the additional roles reimbursement scheme in general practice. Therefore, because we see this coming into general practice now, and we know what how difficult the transition roles are into general practice, especially those nursing roles from secondary care into general practice and some community roles into general practice, we decided that we would look at developing a programme of support for those registered nurse associates that would be now stepping and transitioning into general practice. And this support foundation programme that we're looking at will be similar to our practice nurse foundation programme that will be spoke about soon. Thank you. Next slide, please, Karen.
My name's Ellie Pearson and I am a training nurse associate and I work at the Medical Centre in Primary Care Doncaster. So at school I was quite a chaotic student. I found being hands-on rather than playing, which is probably why when I left school I didn't go to sixth form, I dropped out and worked at next. And then I went for a position working on autistic adults, which was really cool. So it's very varied. So I'm there to support the nurse. The nurse will focus more on the clinic reviews, and I'll do injections, asthma reviews, diabetic reviews, blood tests, reproductive care. The biggest challenge to TNA, especially in primary care, is trying to get what our role is across to people. We kind of think we're replacing nurses. We're not there to replace them at all. But our own role, we're there to support them and just sort of bridge that gap between it.
So how did you overcome that challenge?
Just promoting it and just being myself and just keep doing what I'm doing and not listening to the negative posts about them. I think primary it's very hidden, so more just in healthy patients, but the difference that we can actually make to a patient's life to try and keep them out of hospital. I think that's the most I love about it, the difference we can see in a patient's journey. The most rewarding part is probably the relationships you build up with the patient, the trust that they gain, and the friendships you've got in primary care. Everyone's there to support each other, you know everyone's role, and you know that you've got the support there if you need it.
Thank you very much. That one shot.
Thanks, Kerry. So the next step from that then is the registered nurse degree apprenticeship. So offered by many universities as a full-time course of study. And we're quite fortunate in Greater Manchester that the University of Bolton hopefully will be commencing a part-time option next year. This elongated programme, which will take 4 years plus to register, to finish, will enable both the healthcare support worker and assistant practitioners in general practice to train to become a registered nurse without leaving their employer. So the apprenticeship will support the training for 3 days a week as a student and making it able for them to continue working in the practice for 2 days. So just a normal, so they would become registered nurses at the end of 4 years and 30 weeks. Next slide, please, Kerry.
Hi, I think this is my bit. So I want to introduce the GPM Foundation programme. So it's unique to, our programme is unique to Greater Manchester. Can I have the next slide, Kerry, please? So it's a bespoke, fully funded course that covers all the costings, including cytology training, IMS and VACs, and it's been developed with Salford Primary Care Together Academy and the HMR Academy and the University of Salford. We've got 30 places on a 1-year preceptorship programme. So that's nurses new into general practice in the last 12 months, nurses from secondary care, district nursing, return to practice. And we've also got 30 places on the 2-year fellowship programme, which Sam's going to talk about in a little while. Let me just find next slide, please. Oh, it's fully funded as well, and it includes backfill money. So the programme is a 30 weeks, 1 day a week course, and it's accredited by the RCGP. You will have a supervisor in practice and an external assessor to monitor the foundation skills. A PAD document will be needed to be completed. Now, due to COVID at the moment, we're doing it virtually, but there will be some small one-to-one sessions. It will include OSCEs and preparation in some courses for the portfolio. It is accredited by the University of Salford, and it includes the Q&I standards of education that were new into general practice in May 2020. Next slide, please. Oh, that's you, Sam, I think.
Thanks, Moira.
You're on mute, Sam.
Oh. I'll never unlearn that. Thanks, Moira. I was just saying how you're really enthusiastic about the foundation programme, because it's fed back really well, hasn't it? It's really fantastic offer. The General Practice Nurse Fellowship, which is a national offer, which is also running concurrently with the foundation programme, is part of the NHS England long-term plan. And it's a 2-year programme of support, and it's available to all newly qualified nurses working a substantive post in general practice. It offers support from a non-clinical almost point of view around portfolio working and learning and development post-registration. And it has the added benefit of having funded mentorship and funded CPD opportunities. And unique to Greater Manchester, it's been really successful, the fellowship as a whole package, and we genuinely believe it's due to the clinical arm that we've got in Greater Manchester. The foundation course, that as it worked together and as a combination, just gives a more rounded and whole package. Next slide, please, Kerry. So there's quite a formal structured framework that you can follow, which you can read through at leisure rather than reading through. And again, it's part of the national offer around more professional development, which then runs concurrently with the clinical package, as Moira detailed. Next slide, please, Kerry. So then the next step, almost on the career ladder of opportunity within Greater Manchester, is the development of becoming an advanced clinical practitioner. So the offer of the apprenticeship is included for the advanced clinical practitioner. It kind of almost finishes the whole development to see how far you can actually take your lifelong learning as a NMC registrant, as a nurse in general practice. It typically is a master's or equivalent qualification. It isn't to be a specialist nurse. It's an advanced practitioner, and the two are different. You can be an advanced practitioner with a specialism, but being a specialist doesn't necessarily make you an advanced practitioner either. So it's about a functioning level of skill, and it isn't just about clinical skill. There's 4 domains in practice. And your 4 domains will be your clinical practice, of course, facilitating learning in practice for others too. So that's also about leadership, and then evidence and research development. And it just makes a more broader package of a clinician. And although it is open to other registered practitioners, it has been trailblazed for years by the nurses. And to kind of evidence that pathway that we've detailed, we've gone through right from the beginning, right to this point, is doable. From a more personal note, it was nearly 20 years ago I started off as an apprentice in an office in general practice, and it was a modern apprentice then as an administrator. And here I am now undertaking this pathway that we've just detailed through to end up as an advanced clinical practitioner. So it really is possible. Next slide, please, Kerry.
Thanks, Sam. That's really good. Thank you. It just shows that pathway. It really does. It can work. Right, so this is about the CARE programme. So I know it was mentioned earlier within the look around the website, but just to tell you a little bit more detail. So this is for nurses that are already in general practice. It's a nationally commissioned leadership and development programme which will empower and develop our future nurse leaders. It's designed to build practical leadership skills, personal resilience, self-awareness, and empower nurses in general practice to play a key role in shaping services and strengthening the nurse leadership in the new primary care networks. We're really excited about this programme, and although it's nationally commissioned, we've also got extra funding so that we can roll this out across all 67 PCNs in Greater Manchester. That means that we can have 1 nurse leader in each PCN area, which is phenomenal, really. So we're really looking forward to that. Thanks, Kerry. Just finally then, to round up, 2020 was to be the year of the nurse, and it marked the bicentenary of the birth of Florence Nightingale. And it was always going to be significant for nursing and midwifery, with many global plans to celebrate and commemorate a contribution to nursing. Then the global pandemic COVID-19 appeared. The response to COVID-19 has highlighted how nurses are there every step of the way in healthcare, from primary and community social through to secondary care and beyond. And now more than ever, people need to connect with others, if only for a moment. And often that connection, that person, is a nurse. As nurses, we hold a special place in people's lives and feel incredibly privileged to stand beside others at some of life's most profound moments and darkest crises. It's really important, though, that we take time to look after ourselves and our colleagues at these difficult times. So here at GM, we've developed a number of arenas for such support, from individual health and wellbeing support to a GM-wide nurse forum, to showcase not only the best of nursing in GM, but to keep nurses connected, informed, updated and inspired. Thank you.
Fantastic. Thank you, ladies. Just before we open up for questions, there is a slide at the end that has some useful links. It makes reference to all the topics that have been referred to today. So do take your time to have a look at that and make best use. I've just noted I've missed something, so before I share the slides, I will make sure that that's updated. So, have we got any questions? Don't think we have we? Oh, we have got a hand up. Suzanne.
Hi, yeah, it's really good to hear about all of your work. I particularly loved the careers website, thought that was great and really helpful. I just wondered, is it as part of the roles that we're looking at, are you looking at any link roles between primary care and secondary care? Because I'm the cancer workforce lead for Greater Manchester, and often there can be that disconnect, you know, for patients moving from primary care to secondary care. And I'm looking at the cancer support worker role. You know, they're very much based in secondary care at the moment, but how we could use that role to kind of bridge that link with primary care for our patients, and not just at the point of diagnosis, but when they are moved back into primary care for the cancer care reviews and that kind of thing. So just keen to hear your thoughts of whether there are any developments being planned around that at the moment.
Yeah, definitely, Suzanne. That's something we'll be looking to in the future. Definitely, yes. That joined up working.
Great. How best to link in with you around that?
I suppose that's through myself at the moment. So if you just contact me, we can get that that connection going. We do link in with the Great GM PMO office. So we do know the work that's going on in secondary care. So there is a link there that we can we link up with. But yeah, we can get that moving. Yeah, no problem.
Brilliant.
Great stuff. Thank you.
Suzanne, last week as well, there was a presentation around rotational working, and it's some of that's being piloted in Tameside and Glossop at the moment. So we're really excited to learn kind of what will come out of that rotational offer, and then how we can take that forward. So there's a number of avenues being explored.
Great, thank you.
Has anybody got any other questions? Okay, well, thank you very much for joining us today. We hope that you found it useful. The slides will be available to you all, and there is a point of contact on the slides if you wanted to reach out to the partners that have presented today. So feel free to